Whether you are stringing up those Christmas lights, shoveling snow, trying out a new recipe in the kitchen, or giving it your all in a game of family football, sometimes the holidays can hurt, literally. Local ERs tend to see a spike in visits around this time of year. So to hopefully avoid adding to that count, we are speaking this morning with Dr. James Bicos from Michigan Orthopedic Surgeons. Dr. Bicos, thanks for being up with us early this morning.
Good morning. Thanks for having me on, and hopefully you had a great Thanksgiving holiday.
Absolutely, and injury-free. I hope yours was as well.
Yeah, mine was too.
So let's talk about some of those common injuries you see around the holidays. How are people getting hurt? What are the most common reasons people give you for when they end up in ERs?
Yeah, so most of them are not even glamorous stories. You really don't want to be telling anyone about them. But, right now we're seeing simple things like tripping over extension cords. When you're putting up the Christmas tree, tripping over the tree skirt. Concussions we see from that good old-fashioned family football game that everybody goes to. And then simple things, when you're putting up lights or decorations, and you're standing on a ladder, standing on some furniture, and then you slip and fall.
And speaking of that, some of those activities, I'm thinking about hanging up Christmas lights. If you're on a ladder, people are high off the ground. How severe are we talking about with these injuries? I imagine in orthopedics, falling off a ladder, that could be a big one.
Yeah, it can. Luckily, most of them are just bumps and bruises, and people come in and, x-rays don't show much. But sometimes, especially falling off a ladder, you can get a concussion like what we said. You can break your, an arm bone or even kind of, ankle injuries, and ankle sprains are actually pretty common too.
And just this week, Dr. Bicos, we saw in Buffalo the real physical impact of exertion in the snow. And I'm thinking especially with people who have seniors in their home, what should people be remembering when out there, whether you're snow blowing or shoveling? Because I don't think people think of that as a dangerous activity, but it can be, right?
Oh, absolutely. Yeah, that actually has a lot of exertion to it and kind of raises the heart rate. So if you're not used to it, you definitely want to take frequent breaks. We don't think about hydrating when we're outside in the cold, but you can actually get dehydrated very quickly. So just make sure to take a break, go inside, warm up, and then have something to drink.
Those are all really, really good pieces of advice. What are some things that people can do to avoid those other common injuries? Is it, lifting the right way, wearing a protective brace, those things you can do before you start the activity to avoid getting hurt?
Yeah. So again, stretching, something we don't always talk about or you don't get into beforehand. But again, lifting, you don't want to lift just from your back. You want to actually lift from your legs. So squat down, grab the object, and then use your legs in order to lift that up to the tabletop. Finally, when you're lifting with your arms, keep things close to the body, and that'll also limit the strain on the upper arm.
And so one other piece of advice, Dr. Bicos, that we're looking for here, a trip to the ER. We know that can really ruin a holiday party. It can be costly, but it's important to obviously go if the injury is serious enough. What are some things that people can use as a gauge to know, okay, we need to take this to an urgent care or an emergency room, or maybe this is something that we can deal with at home with some ice and Band-Aids?
Yeah, definitely, any joint that swells a lot, probably something that should get looked at. The other thing is that pain that continues to get worse. That's not going to get better with just simple ice, elevation, maybe a Tylenol. That's something to take a trip to the ER for, or to an urgent care too.
Really, really helpful pieces of advice. Dr. James Bicos with Michigan Orthopedic Surgeons. Really quick before we let you go, where can people go for more information?
Sure. Yeah, to schedule an appointment, you can go to miorthosurgeons.com, or you can call 833-MOS-DOCS. And we also have an urgent care that's available too.
Well, thank you so much for being here. We hope that you don't get a lot of those calls for holiday-related injuries, but we're so happy that experts like you are available if that's necessary. Thanks for joining us, Dr.
Thanks for having me
Bicos.
on. Thank you.